The Ministry of Health, Wellness and Elderly Affairs informs the public that we are in the midst of the flu season, which spans from October to March. This is a period during which infections by respiratory viruses tend to increase. As we enter this high-risk season, the Ministry is urging all residents to take proactive steps to protect themselves and others from respiratory illnesses. As an island, St. Lucia is particularly sensitive to viruses circulating internationally. The continuous movement of people across borders means that respiratory illnesses present globally can quickly reach our shores. Because of this, the Ministry of Health remains vigilant in monitoring circulating respiratory viruses to guide our preparedness and response measures. So far, global reports indicate low activity of the COVID-19 virus, but increasing circulation of the respiratory syncytial virus and the seasonal influenza virus, specifically influenza A subtype H3N2. Similar trends in the circulation of respiratory viruses are observed in St. Lucia. At present, reported cases of COVID-19 virus are low, with most cases having been detected earlier in the year. Respiratory syncytial virus shows some activity currently, while the seasonal influenza virus is currently the most active virus and is the leading cause of many respiratory symptoms in the country. As per global trends, influenza A subtype H3N2 has been detected in individuals presenting with respiratory symptoms at our healthcare facilities. There are many subtypes of the influenza A virus, among them H1N1 and H3N2 most commonly affect humans. H3N2 has been detected previously in St. Lucia. H3N2 is known to cause more intense respiratory symptoms and complications, particularly in young children, the elderly, and persons with weakened immune systems. Respiratory viruses spread easily from person to person through coughing and sneezing, close contact with infected individuals, touching contaminated surfaces, and then touching the face. To reduce the risk of acquiring and spreading these viruses, the Ministry of Health strongly encourages the public to follow these preventive measures. Wash hands frequently with soap and water or use an alcohol-based hand sanitizer. Avoid close contact with individuals who are sick. Wear a mask if you are sick or caring for someone who is ill with respiratory symptoms. Cover your mouth and nose with a tissue or your elbow when coughing or sneezing. Clean and disinfect commonly touched surfaces regularly. Avoid going to work or school if you are feeling unwell to prevent the spread of the illness. Vaccinate. The flu vaccine is available free of charge at all wellness centers island-wide. We strongly encourage vulnerable groups, including the elderly, pregnant women, and individuals with chronic health conditions, to receive the flu vaccine as an effective means of protection. Please seek immediate medical attention should you or anyone experience severe respiratory symptoms such as straining to breathe, sudden onset of shortness of breath, intense chest pain, rapid or shallow breathing, and mental confusion or drowsiness. The Ministry of Health, Wellness and Elderly Affairs remains committed to protecting the health of our population. We will continue to provide updates throughout the flu season and encourage everyone to take the necessary precautions to help keep our communities